show. This one's for the warrior. Yeah, one time for the warrior. This one's for the warrior. Yeah, one time for the beyond the show. This one's for the warrior. Yeah, one time for the.
Hi, I am Tabitha McGee. Welcome to Beyond the Show. This is a companion podcast to our TV talk show, Unveiling Sickle Cell Beyond the Pain. I am the CEO of the Sickle Cell Foundation of Georgia, and I'm also your host of Beyond the Show. In the United States, there are about 100,000 individuals living with sickle cell disease. Around the world, worldwide, there are millions that are living with this awful disease. And while it mostly affects African Americans, we do have others that are impacted by sickle cell disease as well. And they are in South America, the Caribbean, Central America, Saudi Arabia, India, and the Mediterranean. It's widespread, and that's one reason it's so important for us to share more information about sickle cell disease. That's what we do here every week, every day, in and out. We serve the sickle cell community. And you can help us by informing your friends, your family, your colleagues by simply clicking right here. I don't know, the button on this side or that side. Clicking right here, like it, tag us at sicklecellga.org. Share this information with everybody that you know. It's very, very important for us to get the word out. Today, I'm really excited because we have Danina Battle here with us. Danina Battle is the director of our community health workers, and every day she battles for the sickle cell warriors. Danina and her team do a lot of hard work in serving the community. So Danina, welcome to Beyond the Show. We're so happy to have you.
Thank you. I'm happy to be here.
You're welcome. So Danina, first we want to just kick it off by telling us, what is a community health worker?
A community health worker is a frontline service worker that provides the most vital care and attention for the clients that they serve. They are the boots on the ground. They bridge the gap between the needs of the client and the resource. They also help them navigate through the process of getting access to the resource.
Oh, wow. That's a very important job.
Mm-hmm.
So they're like social workers in a hospital setting?
Sort of. It can be compared to social work.
Okay.
But community health workers are a little bit more specialized in terms of how they interact with the client.
Okay.
They make home visits. They work more closely with the client in terms of following up.
Okay.
Maybe a little bit more hand holding. So they can build more, they have the capacity to build more relationships in the community on behalf of the client and the community that they serve. So if, say for instance, they need rent and utility, so the community health worker builds relationships with agencies and organizations that provide those funding for individuals.
Okay.
And so they have a direct link into the organization and can provide, provide direct services for that and navigation.
Wow. That is important work. You know, Danina, I always have to tell this story, and then we can go back to a few more questions that I have. But I remember I met you, and you were an employee of Hosea Feed the Hungry.
Yeah.
And there was something that I noticed about you, is that all the clients wanted to see you. So I'm like, when clients are waiting in line and they only want to be serviced by one individual, it must be something unique. So over the months and the years, kind of watch you work. And I was just really amazed by your personality, who you were, and the fact that you can tell that you had this joy inside of you about serving. And so I remember one day we were starting our community health worker program here at the foundation. And Deb, who was the former CEO, unfortunately, she lost her battle to cancer, is no longer with us. And she was like, Tabitha, you know anybody? I said, I know the exact person. Yes, I need to go and find her. So I called over to Hosea Feed the Hungry, and it's like, she's no longer here. What do you mean she's no longer there? They's like, no, Miss Battle resigned. I was like, oh, well, thank you, Jesus. Okay, let me find her. So I remember calling you frantically, and no, I asked them for your telephone number. They's like, ma'am, unfortunately, we can't give out the information. And I was like, you know what, I'm gonna find it. So I went back through my phone, and I didn't have your number, but I had my old phone, and there was your number. And so I was calling, and then it kept going to voicemail, and I was like, dang, she's not calling me back. And then I remember you was like, "Hey, Tabitha, I got your number. I'm just getting off a plane from Africa." And you was like, "Yes." I was like, "Danina, have a job for you." You was like, "Yes, yes, I want to talk to you." And so I was able to get you to come here to be one of our community health workers. And you were in that position for how long?
About almost 4 years,
4
a little
years.
shy.
Okay, a little
4
shy.
years.
One of the best community health workers we've ever had as a part of this program. But you recently were promoted to manager of the community health workers, and January 1, 2026, you'll be our new director. So that's why we already called it into fruition. Our director of the program. And so I'm just excited and delighted. And I've never really met anyone like you that really loves serving people. And it's a godsend. So thank you for all that you do for the community.
I'm grateful just to be a part of the great work that you're doing in the community, and I'm just also grateful that I can continue to serve in whatever capacity that I'm called to do so.
Yeah.
So I appreciate you.
Well, you're called to serve. You can tell it. What training do people need in order to become a CHW? I have a lot of people asking me, and they're sending in their resumes. It was like, I would like to be a part of that. So what training specifically do a person need to become a CHW?
I would say the most important training, and this is just my opinion, is just being trained in motivational interviewing.
Okay.
Knowing how to interact with the client, knowing how to be sympathetic or even empathetic to what they're going through, treating them like they are a human being and not just someone that is just, needy.
Okay.
Not treating them like a charity case, in other
Okay.
words. So being sensitive to what they're going through, and making them feel comfortable in a manner as to where they can feel like they can build a relationship with you.
Okay.
Because that's the whole point. As a community health worker, you want to build a relationship, a working relationship with your client, and build that trust between the community health worker and the client. And I would also say cultural competency is important, because we deal with individuals from all different types of backgrounds,
Okay.
religious backgrounds, and cultural backgrounds, of course. And then so you want to be sensitive to that too,
Okay.
and their beliefs, and especially when it comes to medical care and what they feel like they believe in terms of being cared for medically. So you want to be aware of that, and assist them with making choices surrounding what they would prefer, and allowing them autonomy to do so.
Okay. So when you said that they need to be empathetic and compassionate, give me a little bit more about what you mean by empathetic.
So just as a community health worker, you want to let me just start here. Most community health workers, they identify with the population that they serve.
Okay.
It could be directly. Some community health workers, like we have a community health worker here that has sickle cell disease. Well, she's now a program coordinator.
Okay.
But
But she used to be a community health worker.
She used to be a community health
Okay.
worker, and she has sickle cell disease. So she related directly with the clientele that we serve, because she lived with sickle cell also.
Okay.
And because of that lived experience, she was better to able to relate to the clients
Okay.
and serve them better, because the client felt like that she knew what they were going through from firsthand. And so a part of that empathy is lived experience, and being able to identify. So it could be the CHW has sickle cell, or maybe the CHW has needed help with rent or utility in the past, or food, clothes, housing. And so from that standpoint, we're able to relate through lived experience. And that's what creates that strong rapport and bond with the client that normally social workers may not have.
I'm glad that you said that, because that is so incredibly important, is to meet people where they are, right?
Mm-hmm.
And not to look down on anyone, not to become judgmental, because we all know you can go from a slip to a slide to an avalanche very quick. And that's why I think it's so important for us to be transparent. That's why I share my story of the struggles that I've gone through and what I've had to overcome. And the one thing that our sickle cell warriors already face on a day-to-day is being stigmatized, saying they're drug seekers, saying that they're lazy. And none of those things are true, none of those things are true at all. And so I am really thankful that we have a team of, compassionate community health workers.
Absolutely. And I think the education piece that's offered here for CHWs is very important. The education on sickle cell disease.
Okay.
And making sure the community health workers are thoroughly educated, making sure that if they have any questions about sickle cell disease, that we can answer them. I love to go through like maybe a 30-second to 1 minute spiel on sickle cell disease, just to make the client feel like the person that they're receiving care from knows what they're talking about.
Absolutely.
And is educated and can also educate them. So the educational piece is very important as well with the community health workers. And I think that we do a great job here at doing that.
We do. Think about Jackie George, been at the foundation for 46 years, it'll be 47 on August the 1st, and she had that wealth of knowledge about sickle cell disease, and then being able to impart that inside of our other community health workers. Like, it's so phenomenal just to have that resource here with us at the foundation, right?
Yeah, I love it. I'm still learning. I'm still learning. It's so much, so many things you can learn about sickle cell disease. So many new medications coming out, innovative ways of treatment that are manifesting, and so it's always good to stay abreast of what's going on, and then being able to bring that information back to the community health workers so they can share with their clients. So the education is continuous,
Right.
and so and I like that the foundation stays abreast of what's going on.
It's funny that you say that. I've been here for 10 years myself. 10 years now. Wow, time is flying by. Almost 11. It's going almost, because we're in the 7th month, right? And I'm still learning about sickle cell disease. I spend a lot of time doing research and reading online to find out any new innovations, like as you talked about, new technologies that may be available. One of my friends, Sylvester, he had called me like last week, said, yeah, my doctor was telling me about this gene therapy. Yeah. Bluebird Bio, and then we have Vertex. They both offer gene therapy, but yet, that gene therapy is not affordable today. So, do we really call it a cure if it's not accessible and if it's not affordable? So we'll see if that changes in the future. So tell me, how do our sickle cell warriors actually help individuals? Tell me, what does that look like?
How does a warrior help?
How do our community health workers help a sickle cell warrior?
Okay, yeah. So we I would want to specifically talk about transition age.
Okay.
Sickle cell warriors. And one of the major ways that we support the transition age warriors is by walking them through being in pediatric care through young adult care.
So transition age is once they're transitioning from pediatric care to adult care.
Yes.
And that happens like, 18, 19 years old?
So transition starts around age 13.
Okay.
And I say 13 because we're getting them prepared and teaching them how to advocate for themselves.
Okay.
Showing them what the information on their pill bottle is.
Okay.
What the prescription is, when the refill date is. Making them aware of learning how to make their own appointments, learning how to advocate for themselves at the doctor, what to say if they don't like how they're being treated,
Okay.
who to call, who to talk to,
Okay.
How to go about scheduling a new patient appointment for hematology or a new patient appointment for primary care.
Okay.
And just, over the time from 13 all the way up until age 18. I think they age out of pediatric care at age 18 in Georgia. So we try to coax them along through that process. And it's a slow process because we're following them through their teenage years.
Right.
And so throughout that time, the relationships are built with the children as well as the parent or the caregiver. And to let the parent know that, hey, you have support. You don't have to feel like you're doing this by yourself.
Right.
So we support the caregivers as well as the child, mentally, emotionally. And so the community health workers, they provide emotional support as well, or like sort of like emotional counseling.
Okay.
Not certified counseling, but someone to talk to.
Right.
But I'm glad that we do offer mental health services here one-on-one as well as group therapy for the family. So that's also available. And we walk them through that transition.
Wow, that's very important because we know when children are with their pediatricians and their parents, right, they can kind of be coddled some. And so then to have the reality of the shock of now I'm adult and now I don't have all these things available to me anymore. I have to piece them all together, right? So you may have a hematologist in one place, a primary care physician, then you still got to go and get a checkup about your eyes, So yeah, I can see how incredibly important that is. We have many parents calling to Kadeem Harrison, and Kadeem lives with sickle cell disease. And he's the director of our camp now.
Yeah.
And one of the things that I love is that a parent feel comfortable enough calling Kadeem even when their child is having a meltdown or something that's not, going well, and saying, can you come over or, talk to them? And he'll just go over to the parent's home and sit with the child and talk to the child and talk them through whatever struggles that kid may be having. And so I can see why community health workers are really important, vital to our community.
Yeah.
What would you say is the most common ask for help is? What is the most common?
In the metro Atlanta area, the most common ask for help is housing. Affordable housing. And the biggest barrier is income.
Yeah.
And a lot of our sickle cell warriors, a lot of the parents, they are low income households.
Okay.
Many of them, if they have a child living with sickle cell disease that has chronic crises, it's hard for the parent to keep a job, especially if they're a single parent,
Right.
or their support is minimal.
Yeah.
And so they can find themselves often losing their jobs.
Yeah.
And face homelessness.
Yeah.
And so many of them are in need of affordable housing, income-based housing that will support them.
Right.
If they do lose their job, they won't lose their housing right away.
Right.
And so they'll have like a buffer there to at least give them some time to find another job where they can afford their rent. So housing is the biggest issue.
It is, and I know that, and we've started a program here at the foundation to address that called our Prudent Reserve, and Charles James and Alexandra Phillips, they're putting that together right now because we realize that our warriors really need some assistance in that area. And like you said, although they may currently have an apartment, as soon as they miss several days of work or several weeks because they're in the hospital, they get fired and now don't have any income coming in. And now they're unfortunately, displaced. And so I'm really hope that our Prudent Reserve Fund does incredibly well over the next 3 years. So if you're listening, you can donate by going to sicklecellga.org/donate. And I can tell you our warriors need it. They need housing. And so it's very important for us to provide that housing. So yeah. Inside of Atlanta, are there many agencies that offer housing assistance, rental assistance? I know that our community health workers are always in touch, but I just remember just recently, a lot of our agencies found themselves with no funding to assist. Do you know what's going on inside of that area?
Well, I do know that due to budget cuts, with funds that are allocated for rent and utility, has pulled back on the amount of funding that's been allocated to the CDBG block grants.
Wow.
Which is the major federal grants that come down to the states to provide dollars for rent and utility assistance for those that need it. And so because of those cuts, agencies are receiving funding, but the funding is not as much as it was.
Wow.
So they have to distribute the funding in less amounts.
Yeah.
So the client is faced with having to go to multiple agencies to get assistance. And then when they do go to an agency, the agency wants to know, hey, well, what do you have to put towards? Because if you don't have any income, then we can't assist you because you'll be back in the same
next month.
boat the next month.
Yeah.
And so that creates the cycle of needing the assistance. So we, as a community health worker, you want to also evaluate the client's budget, their income. What do they have coming in and what do they have going out?
Right.
And so we want to absolutely make sure that we're realistic with the client and letting them know what they can afford.
Right.
And trying to help them find a quality place to live based on what they can afford.
I remember I had one young lady, one of our clients, and she was determined that she wanted to live in a particular area. I'm like, sweetheart, let's be realistic now. That's not where you can afford to live right now. This is what we have available for you. You can afford it here. And she was not happy with that. And so we do have to have some tough conversations sometime, being realistic with the expectations. And so people ask me, have the Sickle Cell Foundation of Georgia been impacted and affected by the budget cuts from the administration? Absolutely. And you're hearing it firsthand right here that the agencies that were assisting with housing funding are no longer able to assist. So the funds have been reduced. Some don't have any funding at all. And so as a result of that, we're reaching out to all of our lawmakers that are listening to say that stop cutting funds for our people. They need it. And so I also want to ask you, how many CHWs do you have on the team?
6
Six.
right now.
Where are they located?
I have 2 community health workers in Atlanta at the Atlanta location.
Okay.
And I have a community health worker in Columbus,
Okay.
Augusta,
Okay.
Macon,
Mm-hmm.
and Savannah.
Those are rural areas.
Mm-hmm.
Why are we there?
Because there's an even bigger need in the rural area for individuals living with sickle cell disease.
They have to travel far, don't they?
They have
get
to
a
travel far
hematologist.
to get access to a primary care, as well as a specialist that services clients with sickle cell disease. So we want to make sure that we capture not only the most densely populated area, which is Atlanta. We want to make sure we capture those individuals that need services in the outskirts of Georgia.
I do want to give a shout out to Dr. Hiltz, who's leading Valley Healthcare Systems down in Columbus, Georgia. She and I work together and we're doing a phenomenal job. So we're assisting Valley Healthcare Systems by providing the salary for a nurse practitioner, as well as we have Dr. Anyabola that is going down. He's our hematologist. And so thank you, Dr. Hiltz, for all that you do for the sickle cell community as well. And I know she's also trying to bring infusion there like we have here at the sanctuary. So I'm really excited about what she's going to do in the future for our warriors. She's really, really concerned.
Yeah, she has some great programs at Valley Health. They provide wraparound services.
Yes.
Vision, dental, women's health, internal medicine. They just kind of do it all for the community out there. And it's a fairly qualified healthcare center.
Federal qualified healthcare
So
system.
if you're underinsured or no insurance, you can go there and get care if you live in the area and need it.
That is so wonderful. What would you say is the toughest part about being a community health worker?
The toughest part, I would say, is maintaining the community health workers being able to maintain their own mental health.
Okay.
Because we take in so much from working with the public, it's very important that community health workers set healthy boundaries and be able to, attend to themselves mentally and emotionally as well. And so I would say that's the toughest, because it's hard dealing with clients that have a big need and we want to help them. And the reality of it is we can't always help them.
Right. Exactly.
And so that in turn can make us feel a kind of way.
Right.
Because we are community health workers and we are supposed to be able to help.
Right.
But unfortunately, some people we won't be able to assist.
I can imagine that's hard. I am a giver myself, and sometimes you can't give because it will be enabling an individual, right? Mm-hmm. And then when you have to say no, I imagine that will make them feel a certain type of way. And then too, because we are dealing with individuals that are already suffering, not being able to take all that emotional, not being able to separate yourself from the emotions that come from your client and holding on to it. I know you and I just had to have a conversation just recently with one of our people that was really concerned. And I say to every community health worker, if you find yourself overwhelmed or depressed because you can't do enough for your sickle cell warriors, I want them too to get mental health counseling and therapy. I think it's very important for them to do that.
Yeah, absolutely.
Yeah.
I have a therapist myself, so.
Yeah, got to keep your therapist. She makes me a better version of myself. I see her every Wednesday, and I love her. She has really made a huge difference, a huge impact in my life. What would you say is the best part about being a community health worker?
The best part about being a community health worker is the impact that we have on the lives of others.
Yeah.
And the joy that we get from being able to assist when we can.
Yeah.
And being able to help a family and ultimately help the sickle cell warriors live well with sickle cell. And every success is just so heartwarming and it feels good.
Yeah.
And I would say that's the biggest reward, is being the impact.
Yeah, the impact. That's amazing. I feel that because I see what we did for this one client who we've assisted many, many times. And now to see the individual thriving, living well with sickle cell, that is a really good feeling, right? Knowing that you personally was able to assist a person and treat them like humans. Treat them like you would want to be treated if something was wrong with you, right? And so, yeah, I'm excited to hear that. That's kind of cool.
Yeah.
How can I, if I want to become a community health worker, what do I need to do to be a part of this?
Well, well, it depends on what. So, community health worker service various communities. So we got the sickle cell community here, and then you have geriatrics. CHWs work in geriatrics. They work in oncology. They work in internal medicine with other individuals that may have chronic diseases such as heart disease or other areas. So I would say it depends on what area you want to work in. What community do you want to work in that you readily identify with? And just kind of go from there.
Yeah. What is the number one thing that you would tell an individual if they're deciding whether or not they want to be a community health worker? What's that one thing that they must have in order to be a great community health worker?
Do they like working with people?
Do you like working with people? And I know our community health workers actually go out looking for our sickle cell warriors, different hospital systems and all of that. And so this person will have to be a self-starter, a person with that take great initiative as well, right?
A self-starter, take great initiative, native too. If they're not native to the area, they should have been living there quite a number of years to familiarize themselves with the resources available
in that area.
In the area that they're servicing, and just making sure that they're well trained into get acclimated with as much professional development in the arena as they can, and just network is the best way.
And by far, if you're looking for a specialized service to provide community health worker, make sure that you know about that disease or that system before you go. We have people sometimes that come here and they want to interview for Sickle Cell Foundation Georgia, but they don't know anything about sickle cell. And the only thing it takes is going to our website, sicklecellga.org, and you can find all the information you possibly can about sickle cell disease, the Sickle Cell Foundation of Georgia, the different programs, and we call it being prepared for an interview. You remember back in the day, we would have to dress up really well in our navy blues or our blacks and our suits on and have our resumes or our application or whatever. And then you showed up knowing and letting the people know that I'm really interested and I've done all this homework. We have people walk through the door like they're going to go to a picnic.
Yeah.
And I'm like, just because we're a community-based organization, a nonprofit, we're a $5 million company. So we're professional here, right?
Absolutely. And I think that also, you want to come in knowing a little bit about sickle cell disease. If you don't know a lot, educate yourself.
Educate yourself.
And do your best to get acclimated with the services that we already offer. So you'll have questions to ask us.
Okay.
We want people to have case management backgrounds.
Okay.
And
what's case management background? Tell me a little bit about case management.
So being able to manage a person's case. So we don't like to consider our sickle cell warriors as a number.
Right.
However, we do keep case files on the sickle cell warriors because we have to keep track of them.
Right.
And so being able to manage data entry, being able to accurately document encounters with them is a part of case management. And so we want individuals to have quite a bit of background experience in case management and data entry.
Okay.
And also being able to work well with clients.
Work well with clients. Okay. That is very important. Are you currently hiring for any more CHWs?
I am hiring for a community health worker transition community health worker.
Okay.
In the Metro Atlanta, for the Metro Atlanta office.
For the Metro Atlanta. So a transition community health worker, meaning that someone's comfortable working with that young age, 13 through, what did you say?
13 through 18.
13 to 18, okay.
So someone that's comfortable working with transition age individuals, preferably 13 to 18.
Okay.
And then we have a next level transition, which goes from about 19 to 24.
Okay.
So that upper adult level, that young adult level too.
Okay.
So being able to work with that age range would be perfect.
Okay.
Someone that can identify and be able to build a relationship with the young crowd is very important. Because we want to make them feel like they're supported.
Okay.
We want to make them feel like they're at home when they're here and they have encounters with us.
So how do they get their resume to you?
They can go online to sicklecellga.org and click on careers and apply directly through the website.
Okay. Do you want them to send the resume to your email address? No.
Yeah, so the resume will come to my direct email address, dbattle@sicklecellga.org. I will need your cover letter and your resume.
Cover letter and resume. Well, go ahead on, Danina. Cover letter. How can people go about contacting one of your CHWs? You know, you said Macon, Columbus, Savannah, Augusta, Atlanta. You have 2 here. So how do they go about if they wanted to reach out to a particular CHW? What do they do? How do they reach it?
They can call into the office, to the main office here in Atlanta. We are the executive office here. And so you can call into the office, to the reception.
What's the number?
404-755-1641.
Okay.
Call into the main office. The receptionist should be able to direct you to the community health worker that's in your area. You also can go on our website at sicklecellga.org, and the community health workers are listed as well as their contact information.
Oh, wonderful. This has been great talking with you, Danina. I just watched your growth, and I'm so excited that the community health workers have you as their new director. I just see that you're blossoming, they're blossoming. It is the best group of CHWs that we've had in a long time. Yeah. And I think that all matters because of leadership, and so you're a great leader for them. Are there any closing thoughts that you have before we leave today? What's the one thing that you want everyone to know and to leave with?
I would say, I don't know. I don't know.
I'm going to give you a moment. One thought that you want them to leave with about a community health worker, about the work that you do. What's one closing thought? I know you have one. Everybody have one closing thought.
The heart that you give to your purpose will reflect in the what am I trying to say? The heart that you give to your purpose will reflect in the lives of those you serve.
Wow. Okay, now you're going to say that again. You're going to say it a little bit louder, because I knew you had that closing thought, and that's powerful. So I need you to say it a little bit louder, and I need you to say it one more time.
The heart that you give to your purpose will reflect in the lives of those you serve.
Wow. That's kind of like my tagline when I say there's hope in every heartbeat.
Oh, I love it.
Yeah, there's hope in every heartbeat. If there's a heartbeat, there's hope.
Absolutely.
You know? And I was just telling, I don't know, one of my team members this morning that your faith has to be bigger than the fear. And there's a lot of fear that's going on right now in the United States, right? Mm-hmm. People are so worried about so many different things.
Absolutely.
But your faith has to be greater than your fear. And when that faith is greater, there's nothing you can't accomplish. Right?
Absolutely.
You can accomplish anything that you want. You can have it all.
Yeah.
Thank you so much, Danina, for joining us today.
Thank you for having me.
Enjoyed you being here on Beyond the Show, our companion podcast to the TV talk show, Unveiling Sickle Cell Beyond the Pain. If you like and learned something here today, spread the word. Click, share, tag us, and most importantly, leave a review, start a conversation, come back again, because we're going to have many more that we're going to talk to. And we're so excited that you are here listening, tuning in, and sharing this great information. Tag us at sicklecellga.org. And remember, there is hope in every heartbeat. I'm Tabitha McGee. Talk to you guys later.
You need to get this off your chest.